Are they worth it? I don't know. How can I get into OR nursing right after nursing school? I know some people will try you, okay? You might have a better chance of making more than you did in the hospital. Hello everyone, and welcome back to my channel. My name's Ashley, and today we're gonna be making a video. It's a nursing Q&A video. I've been asking you guys to ask me questions about anything with nursing or about OR nursing or anything like that. So I'm gonna answer some of the questions you've asked me in the comments. And I have them on my phone here, so I will be looking at these questions. So if you like my videos, if you find the information helpful, please subscribe, like, and even comment, I mean, I'm only one person. I've only had my experiences. So please tell me your experiences in the comments below, and that can help anyone who's watching or anyone who might have any questions about any of the questions I go over in the video. So follow me on Instagram. My goal is to get to 1,000 subscribers on my YouTube this year. So let's make it happen, you guys. All right, let's get into the question. Okay, so someone asked, what advice would you give to new grads who encounter bully nurses? Now, I know that's been a huge thing, especially in the past with older nurses eating their young. But personally, I haven't seen it as much, I guess the places I've worked at, but I have heard about it happening. And honestly, what I would say to that is, always try to remain respectful as possible. I know some people will try you, okay? And just tell them straight up, I haven't done anything to you, I'm just trying to learn. And you feel like there's some kind of tension or something there, and if they want to talk about it, then you guys can talk about it. Otherwise, you can just say you shouldn't be talked to that way, and you don't deserve to be talked to that way. And I think some people don't think that people will call them out on how they're acting. So if you actually do approach them and tell them how they're acting and tell them how it's making you feel, either they'll fix it or they won't. And if they don't fix it, if you don't see any changes, I would say then you should escalate it to your chain of command. When you're a new grad nurse, you're trying to learn everything, and you should be in an environment that's good for learning and that you feel comfortable in. And how do you feel comfortable asking questions to someone who is bullying you or being mean or anything like that, So you got to find the right place that works for you, and if that isn't, then it's okay. It happens, and you just got to go and find the best fit for you. Next question, someone asked how to study for the NCLEX. So I used something called UWorld. I think you can get it in app form also. You can get it on your computer, and as long as you have an account, you can download the app. But I used UWorld because I heard a lot of good reviews from it. A lot of people supposedly passed. First time with NCLEX with using UWorld. They give you I want to say it's 2 practice exams, and then they have just a whole bunch of questions that's a part of the program, and those questions are really helpful. They give you rationales on why you answered wrong or why the answer is right. So I thought UWorld was really helpful. You learn so much in nursing school, and it's kind of hard to remember all that for the NCLEX. So UWorld was helpful because it definitely showed you what the platform of the NCLEX will look like. So I would try UWorld. And I know there's other programs out there. If anyone has used any other types of programs, please leave them down below so we can help each other out. And then I think I studied for about a month or so, a month and a half maybe, for the NCLEX. Good luck to you if you're taking it soon. I know how stressful it can be. You got this. Third question is, what is the best work schedule for new grad RNs? So I think doing the 3 12-hour shifts will be perfect. I think that'll be good starting off. I don't like saying this because I don't like night shift, but being a new grad working night shift was very beneficial, and I feel like that's a great place to start because you don't have to worry about certain things on day shift. Not all the doctors are there, not all the OT, PT's not there, family members aren't there, unless your hospital allows them to stay overnight and stuff like that. But you don't have all those people on night shift, so you're able to focus on your patient more and like make a good plan for yourself and learn how to prioritize certain things. I'm not saying that you won't have access to the physicians or whoever, because you can call them, but you know, there's a lot going on day shift and a lot of things pulling you in different directions. So I think it's easier to focus on night shift initially. And then once you get good on night shift, I think going to day shift as soon as possible is good. So you can kind of have your life back. I guess it depends on how your life is structured, but for me it was hard having a life during working night shift because I was so tired all the time, and I was sleeping during the day while everyone else was awake during the day, and then at night I was working while everyone was sleeping, you know? So there's pros and cons to both, but I would definitely say 3 12-hour shifts and then working night shift initially would be helpful. The next question, which I think this is a good question: are sign-on bonuses worth it, and how do they work? So sign-on bonuses, basically your employer is offering you, we'll say $20,000 as a sign-on bonus, and then you get paid like your normal salary and stuff like that, or hourly pay. And usually with sign-on bonuses, it's kind of like a contract. So they're saying you get this $20,000 if you stay with us for like 2 years or 3 years, you know, so you're locked in. So are they worth it? I don't know. I personally, if you need to pay attention to the fine print and make sure, because a lot of them will say, you know, you get $20,000 for 3 years. If you don't stay for 3 years, then you have to pay that money back. And that's usually how they work. And if you're fine with paying the money back and you read everything closely in the sign-on bonus, then I would say go for it, you know, especially if you plan on staying there for a long time. But the thing that I'm hesitant about with sign-on bonuses is that you don't know how the work environment's going to be. What if you get in there and it's not what you wanted, not what you pretty much were told the job was going to be? It's stressful. You encounter people that it's not the most healthy work environment. Then it's like you feel stuck there, and you should never feel stuck, you know? So for those reasons, I don't know, I just wouldn't want to be locked into a sign-on bonus situation. You can still accept the job without the sign-on bonus. I think that is an option. So if you really do want the job, you know, you can ask to not have the sign-on bonus. But I just would be afraid, especially as a new grad, to accept one because you don't know how it's going to be and you don't want to be locked into something unless you're good about saving that money in case you need to pay it back to exit that contract. Next question. How does nursing pay compare inpatient versus outpatient? So it kind of all depends. Working inpatient, I feel like you probably would make more working inpatient, but it really just depends, because say you're working day shift, you usually just get your normal pay, and then I think there's also like a little differential. But if you're working night shift, you might get paid like $3 more than if you work day shift in the hospital. But if you go to like an outpatient clinic, I don't think they would make as much as you make in the hospital. I could be wrong. Please let me know in the comments. But like if you work in a surgery center or maybe like a dermatology center, somewhere more specialized, you might have a better chance of making more than you did in the hospital setting. But if you want to go outpatient, you know, there is a chance that you could make more and you can negotiate and everything like that. So I would definitely try to do it. Someone said, considering switching to outpatient and wondering which setting is most helpful in keeping up with nursing skills, like surgery centers, urgent care, primary care, or nursing homes. So I think you'll get the bulk of your experience working in an inpatient setting because you just see so much and you're exposed to so much there, and usually you get higher acuity patients. So that's where you're going to get most of your experience. But if you're trying to go outpatient, I would say the next area you would get more experience in or keeping up with your skills is the urgent care, because it's kind of like an ER, but not as severe. And so you'll see a whole bunch of people with different illnesses or different things going on with them. So because of that, like, you'll have to do, you'll use more skills than you would say in like a normal primary care office. And you'll see more probably than a primary care office is what I'm thinking. And the nursing home, you're not gonna be keeping up with many skills there. The nursing home, all you're gonna be doing is passing meds, and you probably be stressed because there's not a good nurse to resident ratio. So you'll be passing meds all night, and you probably will be assessing the patients, but not really that in depth. You won't see a lot. Surgery centers, if you work in pre-op and PACU, you'll probably get some, use your nursing skills, because that's where you do more assessments and asking about medications and things like that. But if you're in the OR, I don't think you necessarily really use many nursing skills, unfortunately. All right, so now we're switching into kind of more OR nursing questions. So someone said, how can I get into OR nursing right after nursing school? So I think the main way you can get in right after nursing school is if you do a residency. And basically residency is like, you'll apply to whatever hospital it is you want to work at. So say I want to work at this hospital, they'll say like a residency is required. Usually it's like 6 months to a year or so. And residency is nice because you're paired up with a lot of new people in the hospital, a lot of new nurses. So you guys are all kind of experiencing everything together. And OR is one of those residencies I've seen at one of the hospitals I worked at. People were in the OR nurse residency program. So I think that is probably the easiest way of getting into the OR right after school, because you'll have training and they know that you're new, so they're gonna, be more patient with you, won't throw you out there. But I think that's probably the easiest way right out of school, is to look for those nurse residency programs specifically for OR. And I would still say to just, even if you don't see OR residency programs, I would still apply to OR jobs, and I mean, they can always train you still. So I would just say to apply and, see what happens. A lot of places are short staffed, so a lot of times they're willing to teach you on the job stuff, Like when I started working OR outpatient, I never had hospital experience in the OR, which I do wish I did, because I feel like hospital OR is like the basics of OR. But I still know, like, I'm fine now, because everyone taught me, but it was just on the job training, and you're still fine if you don't necessarily start in an OR hospital. Yeah. But if you are trying to work in an OR outpatient right out of school, I think that is harder, because they do want to see that you've had some experience either in the OR specifically or in general. So definitely start with residency OR. Nurse residency for the OR. Someone asked, do you need Peri-Op 101 before OR nursing? No. I think if you work in the hospital and you're new, especially in like that nurse residency program, I think they do have you participate in Peri-Op 101, so you can get all the basics. But I came from working on an orthopedic unit, and then I went to the outpatient OR. They didn't have me do a Peri-Op 101 class, although I wish they did, but they didn't have me do that. I'm sure, a lot of places have education hours, or they have a lot of access to education. So even if your place doesn't offer you the Peri-Op 101, whether it's inpatient or outpatient, I'm sure maybe you could try to talk to your manager about it and see if there's any way that they could allow you to take it, or pay for you to take it, or provide those classes. So because it's in line with your job, so hopefully like that could be a possibility for you, I would definitely ask about that in your interview process if that's something that you want. All right, next question. Someone asked, what kind of things do OR nurses do and what kind of surgeries do you do? So in the OR, as an OR nurse, you can either be a scrub nurse or you can be a circulating nurse. I'm a circulating nurse, so basically what a circulating nurse does is they'll interview their patient, you go to them, introduce yourself, and then you ask them their name, their date of birth, what surgery they're having. Usually ask if they have any metal anywhere in their body, anything loose in their mouth, if they're diabetic, if they have any history of blood clots, any skin issues. You look at their history and you take a peek at their medications and stuff and just make sure that all that's fine. And then, then you bring them back for surgery. Once you get to the OR room, you're just positioning them, watching their IV, making sure that doesn't rip out. You're also prepping their whichever area they're getting surgery on, so prepping their arm, and then you help the techs, the scrub techs or the scrub nurse, you help them get the patient kind of like draped and plug everything in for the surgery. Once the patient is all prepped and ready, surgeon usually comes in, you'll tie everyone's gowns up, and then you do timeout. And timeout is what you do right before the surgery starts, and that's where you confirm their name, their date of birth, and what surgery they're having, on what side they're having it, just so we don't have any mistakes. And after the timeout, the surgery starts. Usually you're watching the fluids, you're getting any medications together that they might need. You're making sure the scrub nurse or the scrub tech has fluids. You're making sure that everyone is staying sterile. If they're not, say they rip their glove or they touch a light with their head or something like that, then you'll get new light handles, or get new gloves, or get new gowns for them, whatever it is that they need. I think I said you get medications together, and then you're also charting. So at my other job, we did paper charting, and we also did have some computer charting as well, but where I work now, we mainly just do paper charting. So get all your charting and stuff done, and then you get all the dressings ready for them to do at the end. And then once surgery's done, you take them to PACU, and then you give them a report, and then you go see your next patient and do that whole process all over again. So a lot of times you are on your feet, but there are some days where you're kind of slower and you're sitting more. So it really is up and down. It's like one day's fast, one day's not. It just all depends on the surgeries and how things are going. And also, I meant to say, the scrub nurse is basically similar to the scrub tech. It's just that the scrub tech went to scrub tech school. Scrub nurse was an OR nurse who learned how to scrub. And scrubbing means basically like assisting in surgery. So passing instruments and helping out in that way during surgery. So where I work, we do all orthopedic surgery. So that's like doing total knee surgeries, total ankles. I think they even have total shoulders and total, I want to say elbows, but I don't know about the elbow. But anyway, so we also do rotator cuff repairs. We do a lot of hand surgeries, wrist surgeries, carpal tunnel releases, ulnar nerve decompressions. We do a lot of foot and ankle surgeries. That's just some of the orthopedic stuff. And then the last question is tips on how to remember positioning and tools in the OR. So kind of like I said, it does take a while to know what the instruments and everything's are, and it takes a while to know what the instruments and everything, and what everything is in the OR. So I would say one of the nurses I used to work with had this little notebook that she would like take notes on and make cheat sheets for. So she would have like for a shoulder scope, what does she need? She'd have it like written down, the medications that she needed. So I think having something like that you carry on you will be really helpful, especially in the beginning. Just like writing down whatever surgery it is, what medications you need, and what positioning tools you need. I think that's probably the best thing that you can have as like a little cheat sheet for yourself. Each surgery has a preference card, and on that preference card it basically says what the surgery is, who the surgeon is, and everything that they want for that surgery. So, and even it includes the medications too. So I always look so closely to those preference cards because they have everything on there, or at least they should have everything on there. So that's going to be your best friend, and that'll tell you everything you should need for the surgery. The scrub texts are so good with all the instruments and everything. So you can even on your downtime, like, have them quiz you or something, or, you know, be like, tell me where this is, or even like I would go into the instrument room and just like walk around and look at everything and kind of like get familiar with what things are, so I know what I'm looking for when they need him during surgery. Those are just some tips. I hope that helps, because I know that can be kind of stressful. You guys, I hope this answered some of your questions. If you have any more questions about nursing in general, or OR nursing, or whatever it is, please let me know. I would love to answer. Please please subscribe, you guys, so we can get to 1,000 subscribers. And comment, and I will see you in the next video. Have a great day, and I hope this helped with any questions you might have. I'll see you guys in the next video. Peace.